Hi there, my name is Dee Hetherington. I'm Head of Occupational Therapy and Integrated Services in Croydon. The purpose of this video is a part of a two-part course. The first part is the video, the second part will be a test and a practical session. The reason for that is to improve access to occupational therapy equipment. We are primary care trust and social services, and so we cater for short-term and long-term essential needs. An example of a short-term need is a hip replacement, and somebody with a long-term need would be somebody with multiple sclerosis. We see people from age 16 and out of school to the end of their life. To keep it simple, generally people with long-term needs are funded by the council tax, so the person needs to be resident within Croydon and paying council tax to Croydon. And where a person has a short-term need, that they are funded via the primary care trust, and so their GP needs to be in Croydon. Obviously, if you have any problems or you're in doubt about anything like this, the intake team is available to actually give you advice on this. We are accountable for the effective use of the budget. I mentioned earlier essential need. Equipment is prescribed for essential need only. People can be given advice regarding private purchase of equipment for desirable needs. An example of this would be a trolley used for carrying food and drink from the kitchen into the main living room. We would only prescribe this if the person didn't have a table in their kitchen. The preference would be for the person to actually sit and eat at their kitchen. If they wanted to take food through into the lounge, then they can actually privately purchase a trolley. If you prescribe equipment to somebody to use in their own homes, you are personally accountable for the assessment and provision and ensuring that the person is able to use the piece of equipment safely. The handout gives you clear guidelines from the Medical Devices Agency and the Croydon Equipment Guidelines. It's important to understand that these are written to ensure equity in provision, and ultimately their use is intended to protect you and to ensure the client or a carer or their family are safe. If you go outside these guidelines, you may need to be able to justify your decision, and if necessary, in a court of law. The worst scenario, if something did go wrong with provision, is that the law will use the Bolam test. This will look at the procedures that are in place, so it will look at something like the medical devices, it will look at the training that you've been given, it will look at the guidelines available, and it will also look at what is usual practice. The guidelines that we have are actually written by the London Borough OTs group, so these are London-wide guidelines. These have been adapted for Croydon, and obviously the Medical Devices Agency is a general agency, so they will look and see what is usual practice and what would be reasonable. So the guidelines are called guidelines because we are not able to make what in law is called a fettering decision. People do not fit into boxes. You cannot make a decision without actually going out and assessing the person first. The intake team also will be able to provide you advice on this. In front of the guidelines you will find the legislation that we work under, and particularly in regards to the Health and Safety at Work Act and the Chronically Sick and Disabled Persons Act. So the first thing you do regarding the prescription of a piece of equipment or the recommendation of a minor adaptation is concentrating on your assessment. And a minor adaptation is something that is screwed to the wall, such as a grab rail, or it can be a bed or a chair raise. In Croydon, it's something generally that a technical officer, or what's called a TO, from the community equipment store fits. You will need to know the client's diagnosis and social needs. You carry out a risk assessment. This runs throughout the assessment process. You risk assess every stage to make sure that what you're doing is safe and that you are sure of what you're doing. For instance, a person with dementia, you would need to think about and risk assess whether or not you would be prepared to issue bath equipment. You are basically opening up an area of a potential fatal accident if somebody run the water too hot, or if somebody drowned, if they had epilepsy, for instance. So you really need to risk assess every step of the way. You need to consider about what equipment is available and what minor adaptations are available to meet that person's needs. So you do need to take responsibility for knowing about the equipment that you are actually prescribing. It's no good relying on the community equipment stores to know about the equipment. It's you that is prescribing the equipment, so it's you that actually needs to know about it. You also need to consider, will the equipment or the minor adaptation minimise somebody's risk, or will it actually increase it? You obviously don't want to increase somebody's risk, but you need to be assessing that as you go along. On assessment, have you taken into account the client's physical capability? Is the client, for instance, able to do what you're asking them to do, like lifting their legs up over a bath by using fine finger movement? Are they actually able to do that? You also need to consider sensory capability. What's their vision like? What's their hearing like? What's their touch like? Can they actually feel what you're talking about? When we're talking about sensation as well, if somebody's had a stroke, if somebody's got multiple sclerosis, they will have reduced level of sensation. So you need to be caring about the skin. You need to be aware that that person might not be able to feel what you're talking about and what you're actually prescribing. Has the client got previous experience of the equipment or minor adaptation? They may well have already been seen by somebody and who had actually gone down the road that you're going down at the moment. So it's always worthwhile chatting to the person to find out. Is the person able to understand what you're saying, and can they remember? So for instance, somebody with dementia or somebody that's not even been diagnosed yet, they may not remember what you're saying, and you need to be aware, you need to be assessing them, you need to be risk assessing them to see whether or not they are remembering what you're saying. The Mental Capacity Act comes in here, and that is a huge area, and you really do need to have some Mental Capacity Act training to ensure that there will come a time when somebody, are they able to make an informed decision about what you're actually doing for them and what you're actually prescribing. Again, the intake team will be able to help you in this. The expectation sometimes of the client, for instance, often we get referrals through asking for a rail to help somebody get out of the bath. Well, often what the case is that they are no longer able without equipment to get up out of the bath. So generally, the general rule is they wouldn't be able to get off the floor. The same principle arises, they can't get off the bottom of the bath. A rail, all a rail does is actually they try and pull on it and they slip and they damage themselves.